early. So another applause for that, I would say. Now, our next team is DIRC Health, and I would like to welcome Leonard Richter on the stage. And the story with Lukas is that he knows that he's going to be pitching since yesterday night. So, give him a warm hand of applause, Leonard Richter, DIRC.
Hey, good evening, everybody. So Lukas is my brother, so I'm Leonard, and yeah, I'm happy to be here. The time's already running. Maybe reset it. Okay. So give me just a second. I want to pick something out of my bag. So, what do you see here? This is probably things many doctors know, and they use it for their daily task. But I think we should go further. We should develop new things, because these bring intransparent documentation, they have poor traceability of treatments, and poor communication among colleagues. So I want to ask you a simple question. If you see this, would you like to work with it? And I would say no one wants to work with things like that. You don't like it. You want to have innovative things. And therefore, we created these pathways that are pathways for clinical, so for the patients, you can see at the beginning, we have got a diagnosis, and you can create these pathways for different diagnoses. So it's a timeline-based treatment overview. So DIRC has 3 levels. First, to create content. So we want to create these pathways for different diagnoses. The second step is that we want to apply these pathways to our patients. So if we have got a diagnosis, we can apply these templates on our patient and on the specific diagnosis. And third, which is very interesting, we would like to analyze these data. So we can see how they perform. We can see critical tasks that cost a lot of money or take a lot of time. And we can also see bottlenecks. So DIRC combines best 3 practices of KISS, BPM, and also checklists. And we want to bring this all together to a dynamic clinical pathway management. And these pathways, they can reduce treatment costs by up to 30%. And on the other side, they can increase patient satisfaction. So it's both quite positive if we use pathways. About the market, if we start with a price of €50 per month per user, so we calculated a total addressable market of around €5.7 billion per year. But first, we would like to start with 3% of the German market, which is around €7 million per year. And it's rather on specialties like oncology or cardiology. So why now? I think everybody here knows we have the Krankenhauszukunftsgesetz. And combined with digital initiatives like ESIG or EPA, we've got good basis to create something new, to be innovative. And also we've got, at the moment, everybody knows it, the pandemic crisis. And the pandemic crisis enables that we can develop things quite fast at the moment. So what have we achieved so far? Well, we evaluated the problem through our co-founder Simon, and we have done some questionnaires as well as interviews with doctors and experts from industry. And that has led to our first prototype, which is just launched at the Charité. So we are quite proud of that. Our team, Lukas is responsible for business, Simon is responsible for medical tasks, and Severin is responsible for tech. And we've got great mentors on our side. So our vision is that all patients should receive the best possible therapy without forgetting any relevant treatments. So that's what it's all about. The pathways, that's what they help. That's why we want to establish them. And therefore, we are fundraising 500K in Q1 in 2022. And yeah, we already got the exist for 2022. And yeah, let's upgrade patients' health with DIRC now. Thank you very much.